Life after prostate surgery, specifically a prostatectomy, the surgical removal of the prostate gland, marks a significant transition for many men. The journey is deeply personal and can be both physically and emotionally transformative. Understanding what to expect after prostate removal is essential for those preparing for surgery, as well as for their families and loved ones. The experience varies, but certain themes and changes are common, and these can be navigated with knowledge, support, and the right medical care. When the prostate gland is removed, it is usually due to prostate cancer or, less commonly, other prostate-related conditions. The prostate is a small gland located below the bladder and in front of the rectum. It's an integral part of the male reproductive system, producing seminal fluid that nourishes and transports sperm. Its removal, therefore, not only impacts urinary and sexual function, but can also have ripple effects on a man's sense of identity and well-being. Immediately after surgery, patients spend time recovering in the hospital. The length of stay depends on the type of surgery. The traditional open procedure or minimally invasive robotic-assisted laparoscopic surgery. Most men are able to go home within a day or two. The initial recovery period is focused on managing pain, preventing infection, and allowing the body to heal. A catheter is typically left in the bladder to allow urine to drain while the surgical site heals. This catheter remains in place for 1 to 2 weeks, and its removal is a milestone many patients look forward to. In the first days and weeks after surgery, fatigue is common, and individuals are encouraged to rest and gradually increase their activity levels. Gentle walking is often recommended to prevent blood clots and promote circulation. Some discomfort and swelling in the pelvic area are normal, and pain medications may be prescribed to ease discomfort. It's important during this phase to follow the surgeon's instructions regarding lifting, driving, and physical activity. One of the most immediate and noticeable changes after prostate removal is urinary incontinence, or the inability to fully control urination. The prostate surrounds the urethra, the tube that carries urine from the bladder out of the body. During surgery, the removal of the prostate can affect the nearby muscles and nerves that help control urine flow. As a result, many men experience some degree of urinary leakage, especially when coughing, sneezing, or exercising. For most men, urinary control improves over time as the pelvic floor muscles recover and adapt. Pelvic floor exercises, often referred to as Kegel exercises, are a cornerstone of rehabilitation. By strengthening these muscles, men can regain greater control over their bladder. In the early weeks, the use of absorbent pads or adult briefs may be necessary, but with persistence and practice, most men see significant improvement within 3 to 6 months. For some, it may take a year or more, and a minority may continue to experience incontinence long-term. In such cases, additional medical interventions, ranging from medications to surgical procedures, can offer further relief. Another significant aspect of life after prostate removal is the impact on sexual function, particularly erectile function. The nerves that control erections run very close to the prostate gland, and even with nerve-sparing surgical techniques, these nerves can be affected during surgery. As a result, most men experience some degree of erectile dysfunction, ED, after prostatectomy. The degree and duration of ED vary. Factors such as age, pre-surgery erectile function, overall health, and whether both nerve bundles were preserved during surgery all play a role. In the initial months, it is common for men to be unable to achieve or maintain an erection sufficient for intercourse. This can be distressing, but it is important to remember that recovery is a gradual process. Some men begin to see improvement within a few months, while for others, it may take a year or longer. There are several strategies to aid in the recovery of sexual function. Medications such as phosphodiesterase inhibitors, like sildenafil, Viagra, TADALAFIL, Cialis, or vardenafil, Gil, Levitra, may be prescribed to enhance blood flow to the penis. If oral medications are not effective, other options such as penile injections, vacuum erection devices, or penile implants can be considered. Sexual rehabilitation programs, sometimes called penile rehabilitation, are designed to promote healing and encourage the return of erectile function. It's also important to recognize that sexual satisfaction and intimacy can take many forms beyond penetrative intercourse. Open communication with a partner, exploring new ways to connect, and focusing on emotional intimacy can help couples maintain a fulfilling relationship during this period of adjustment. The removal of the prostate also renders a man infertile. Without the prostate and seminal vesicles, the body can no longer produce semen. As a result, ejaculation does not occur, a phenomenon sometimes referred to as a dry orgasm. While physical pleasure and orgasm may still be possible, the absence of ejaculate can take some adjustment. For men who wish to preserve their fertility, sperm banking before surgery is an option worth discussing with a healthcare provider. Beyond the physical changes, the psychological and emotional impact of prostatectomy should not be underestimated. The diagnosis of prostate cancer and the subsequent decision to undergo surgery can be overwhelming and anxiety-provoking. After surgery, men may experience a range of emotions, including relief, sadness, frustration, and concern about the future. Body image, self-esteem, and sense of masculinity can be affected, particularly in the context of urinary incontinence or changes in sexual function. Support from healthcare providers, family, and friends is crucial. Joining a support group, whether in person or online, can provide valuable perspective and reassurance. Many men find comfort in sharing their experiences with others who have gone through similar situations. Counseling or therapy can also help address anxiety, depression, or relationship concerns that may arise during recovery. Physical recovery continues over the months following surgery. As the body heals, most men gradually return to their normal activities, including work, exercise, and travel. Regular follow-up appointments with the urologist are essential to monitor recovery, manage any side effects, and screen for cancer recurrence using prostate-specific antigen (PSA) tests. A detectable PSA after prostate removal may indicate residual or recurrent cancer, and additional treatment options can be discussed if needed. Diet and lifestyle also play an important role in recovery and long-term health. Maintaining a healthy weight, engaging in regular physical activity, and eating a balanced diet rich in fruits, vegetables, lean proteins, and whole grains can promote healing and reduce the risk of other health problems. Avoiding tobacco, limiting alcohol, and managing stress are also key components of a healthy post-surgery lifestyle. For many men, returning to a fulfilling and active life after prostate removal is entirely possible. It may require adaptation, patience, and support, but the majority of men regain urinary control, find new ways to enjoy intimacy, and continue to pursue their passions and goals. The journey is unique for each individual, shaped by personal circumstances, health status, and the support network around them. It's also worth noting that some men experience changes in bowel habits after prostate surgery, though these are generally less common. The proximity of the prostate to the rectum means that, in rare cases, temporary or persistent changes, such as urgency or mild incontinence, can occur. These issues are typically manageable with dietary modifications, medications, or pelvic floor therapy. Another consideration is the potential for lymphedema, or swelling in the legs or genital area, if lymph nodes are removed during surgery. This is relatively rare but can be managed with specialized therapy, compression garments, and exercise. The long-term prognosis after prostatectomy depends on the reason for surgery and the stage of any underlying cancer. For men with localized prostate cancer, surgery can be curative with excellent long-term survival rates. Ongoing monitoring with PSA tests ensures that any recurrence is detected early. NITI and additional treatments, such as radiation or hormone therapy, can be initiated if necessary. Family dynamics and relationships can also be impacted after prostate removal. Partners may need to adjust to changes in intimacy, roles, and routines. Open communication is vital, as is mutual support and understanding. Couples counseling or sex therapy can help partners navigate these changes together, fostering resilience and closeness. Work and social life can also be affected, at least temporarily. Fatigue, urinary symptoms, or emotional challenges may impact confidence and participation in social activities. With time, support, and appropriate accommodations, most men return to their previous levels of activity and engagement. Travel is generally safe after recovery, though planning ahead is important. Men who experience persistent urinary leakage may wish to carry extra pads or briefs, and those with sexual side effects can discuss options with their healthcare provider. Maintaining a sense of humor and perspective can ease the transition and help men adapt to new routines. Looking ahead, many men find that the experience of prostate surgery and recovery leads to a renewed focus on health, relationships, and personal growth. Some become advocates for prostate cancer awareness, sharing their stories to educate others and promote early detection. Others find new hobbies, interests, or ways to give back to their communities. Ultimately, life without a prostate is different, but it is by no means diminished. The challenges of recovery are real, but they can be met with resilience, adaptability, and support. Advances in surgical techniques, rehabilitation, and supportive care have made it possible for most men to regain control, confidence, and quality of life after prostatectomy. If you or a loved one are facing prostate surgery, remember that you are not alone. A team of healthcare professionals, support groups, and resources are available to guide you through each stage of the process. With time, patience, and perseverance, it is possible to not only recover, but to thrive in the next chapter of life. In conclusion, life after prostate removal is a journey marked by change, adaptation, and ultimately, hope. While challenges such as urinary incontinence and changes in sexual function are common, they are often temporary or manageable with the right interventions. Emotional support, open communication, and a proactive approach to recovery are key to regaining confidence and quality of life. Whether you are preparing for surgery, in the midst of recovery, or supporting someone you care about, knowledge and understanding are your most valuable tools. By embracing the journey with courage and resilience, you can move forward with optimism and renewed purpose.